hello, and welcome to House Calls with Dr. Gigi. Now, let me go ahead and talk about the elephant in the room. I am not Dr. Gigi.
Me neither.
Enough from the peanut gallery. We haven't even introduced you yet. You're already fired up. Okay. Uh, I am, of course, Ellis Dean, and I am Dr. Gigi's producer slash co-host when she does her show. And but she is on vacation. She is indisposed. And she said, Ellis, I want to keep the show moving. So can you bring on a guest and keep our rhythm? And I said, sure. And as we talked about last show, we were talking about coping through these turbulent times. And I said, I've got the perfect person, somebody that you all are familiar with, and that will be a perfect foil to my foolishness for this hour that we have planned for you this evening. And that is none other than our former host of I'm Not Crazy But, and that is Dr. Rhonda Mattox. And so, Dr. Rhonda, it's great to see you. This is fantastic.
It is. Thank you for thinking of me. Thank you for inviting me. And I'm always glad to come back.
Well, that's perfect. So we're glad you're here. So a couple of things I need for you all to do before we get started on part 2 of our show. The first thing we need to do is let us know where you're watching from. We'd like to know where people are watching us from all over the world. So please drop that in the comments. Number 2, if you know somebody that needs this information, make sure you let them know and tag them, and so they can watch this program live, or they'll watch it later on since you've tagged it. And then number 3, if you have any questions throughout tonight's broadcast, please drop those in the comments, and we will try to get as many of your questions asked and answered, because we're going to be talking about a variety of topics as we move forward to part 2. Now, just a recap of part 1. What we talked about really were the natural ways. So we talked about exercising, we talked about eating right, we talked about getting enough sleep to maintain your kind of mental and centered self. Tonight with the psychiatrist on board, we're going to talk about some of those things where she's going to give us that line of demarcation a little bit. That line that says, hey, when is it time to talk to a professional, to move from home remedies, where you got your teas and your your different things that you do, to where, hey, you might want to bring in a professional to have talk therapy. And then there's another line. And that second line is, hey, maybe we need to introduce some medication in order to help recenter you, help bring you back to center. And then we can talk about the different types of medication and, if there's an opportunity for you to kind of get off of them as you can center yourself without kind of pharmaceutical help. So we got all that on the table tonight. So, because we know Black folks, some of y'all, we don't really like to do the medication thing a little bit, unless it's your blood pressure and your sugar, then you think you can eat anything, but that's a whole other show. That's a whole other show. I'm not. So welcome, Dr. Mattox. First question for you is, as a psychiatrist, I know when people hear that term, they always say, oh, they're just going to give me a pill. When you meet with a patient, is your first thought medication, or what is your first thought when a patient is coming to you and says, hey, I'm having some difficulties in life?
Actually, my first thought is to really get to understand the root of what's going on. So often we want to get to the fruit of it, treat the fruit of it, but getting to the nitty gritty and understanding the root of it. Sometimes some of this stuff is triggering because it's reopening old wounds. Other times it's fresh and it reflects betrayal or complete surprise or what have you. So really for me, it's not going for medicine at all, unless of course maybe they're suicidal or they're having panic attacks or they're psychotic. But it's really kind of understanding what is really at the core of whatever these beliefs are that they're expressing.
Well, that makes sense. You got to get to the root, right? That's a good point. And I know as we get older, sometimes those roots get a little bit deeper, a little bit harder to get down to.
That's right.
But with work and with you, the person, the patient being committed, and I think I will say that part for you. I think the patient has to be committed to wanting to improve their life, needing that change and working with you and taking your recommendations versus just coming there and saying, help me, fix me, doc. And because
And I'm always interested in what actually prompted them to get help, because that can give you a lot. Sometimes it is not them hitting rock bottom, but it's others taking notice. Maybe they're having some challenges at work and they've been put on some kind of improvement plan, or they're having trouble with their children or having trouble with their partners. And so that piece of what is in it for them right now is also very telling.
well, that's one of the keys, right? So we say, and just for the kind of a more technical term when people hear about it, do you have disturbances in your occupational or your social life, right? So if you're having problems at work, you're coming in disabled, you're coming in late all the time. Some people may have advanced to the point where they find themselves drinking on the job. They find themselves
Absolutely.
doing other types of really self-medication exercises just to cope. That can become very noticeable. Even when you're trying to hide it, people can see it. They may report it. And then in your home, are you having difficulties at home? Are you withdrawing from your relationship, whether you have a primary relationship or just your friends, your family, your church family, your whatever your extended family? Are you withdrawing from them, or are you acting erratically? Um,
Absolutely. Because many times we don't have insight into what's going on with us. We'll think we're just fine, and others will notice that we're more irritable, that we're more cranky. Maybe our spouse notices that we're not coming to bed at a reasonable time anymore, or those types of things. People at work notice that you're not getting your work in on time, or you're not showing up on time. So your pattern shift, and others notice it sometimes before you do.
Absolutely. So the point of this show is how do we cope in these turbulent times? And we understand that we're not going to talk anything politics. We're not going to get political, but we understand that the climate in the country has lent itself to more stress. People, I find the posts that are coming up on my social media timeline are a lot of people, a lot of angry people, a lot of people are stressed, a lot of people are depressed, and all of that. And so I'm sure there's going to, as a result, if this continues over time, there's going to be an uptick in people that are needing some sort of mental health services. You know, those people that haven't reached that breaking point yet, what are some things what's some advice that you would give them in order to help them kind of navigate through some of these kind of turbulent waters that we're going through?
I think the first order of business would be to identify what their safe spaces are, where those safe
Mm,
places are, because so often we're at work and we're code switching. We're in we're in these environments, and maybe politics come up and we feel very defensive. So the first order of business for me is really identifying where your safe place is, so that you can start to let your guard down, so that you can really honestly reflect where you are and do a pulse check on yourself. When we're in these spaces where we have to code switch, or we have our mask on, our work mask on, our church mask on, or whatever, we're not being honest with ourselves all the time. So when you identify a safe space, this is a place where you can come to, and you don't have to worry about creating this false narrative. You don't have to worry about bringing your strong woman or your strong man there. And then you can really check in on yourself in a safe place.
yeah, very good, very good. I love
So
it.
that piece right there.
No, that's paramount, right? So whatever that is for you, if it's, if you like to exercise, going to the gym, maybe your gym is your safe space. If you are very religious, maybe having that meditation, that time where you're reading your Bible or you're reading scripture, that might be your safe space. But I think ultimately finding that place where you can kind of disconnect
Mhm.
from whatever's happening in the world, whether it's work, home, socio-political climate, find a space where you can disconnect, even if it's for 30 minutes, an hour. And maybe that's a good question. It's got to be for a somewhat extended period of time. It can't be, can it? Does it have to be 30 minutes, or can it be 5 minutes, or how long does that safe space uh,
Yeah. Well,
extend?
I'll say in the beginning, start where you are, use what you have, and do what you can. as Arthur Ashe said. So if you only have 10 minutes, don't stress about not having an hour. Start. And you may be able to, at work, still away for 5 minutes or still away for 10 minutes, or take your lunch break. Finally, start taking your lunch breaks. Start taking those breaks so that you can still away. Don't take your lunch break in your office. Go to the car, go for a walk, go to the park. But if you are in your office, there's always that very intrusive / happy, friendly coworker who finds their way to your office to say, "Oh, do you have a minute?" and then monopolize your complete lunch break, and you find yourself working. So finding a way to still away, and just for whatever time that you have. And for, as you said, a lot of people like to go work out. Some people do line dancing now that they are clicking that fan and getting out there, putting their boots on the ground. So those fun things, but stealing away for the amount of time that you have, taking staycations to where, if you can't get away for a weekend at some designer place, just a staycation,
First of all, I feel like you've been peeping into my life when you were talking, because I was like, one, I'm notorious. When I'm at my office, I will eat lunch. I'm still 2020. I will get Uber Eats to the office and and sit at my desk. The other side of that is, it seems like, oh, Ellis is walking into his office with a bag of food. He obviously wants me to come in there and talk to him. And you're like, no, Jesus, this means.
Well, and the thing about it is, because we are such naturally friendly person and we give off this vibe, we don't necessarily, we are inviting people, and we don't mean to say, hey, I'm always available, but we have that I'm always available vibe. And so people like hanging out with us because we bring our sunshine to the office. And I personally realize, because I make people feel loved, because I make people feel seen like you do, that we're a magnet to people. And sometimes our offices, even though the doors are closed, it's like, oh, let me just knock and peek in. Are you,
Let me just knock. That's always
right.
Okay.
So if you see me in my car, leave me alone, is what we're saying. We're having a business meeting with ourselves. Leave us alone.
It's interesting. I love your other tip. Take a staycation, because a lot of us, sometimes people work from home, or they have other stressors at home. You might have a multi-generational home where you're caring for a parent and you've got children. That's 3 different generations in the house at one time. So there might be some turmoil, some chaos at home that doesn't allow you, but you may not be financially prepared to go jump on a plane. Plane tickets are expensive.
Right.
But that staycation where you can, hey, can I get a room at downtown on the other side of town and do the staycation thing, or do something. Sometimes you get in cities. I live in Atlanta. There's some places I've never been, and people come here to see those things. Mm-hmm. Just changing your routine of what you do on the weekends could re-energize you and recharge you by just doing something different.
Absolutely. It's interesting that you talked about the extended or the multi-generational, because that poses some benefits and some risk, because sometimes you have that multi-generational because you are in a caretaker role, but other times you have aunts and uncles and different ones who are present who can actually take the load off of you and can give you and your partner a night out on the town or those types of things. And so really assessing what value and what strengths they can add to it. I grew up in a very small town with my grandparents next door to me, my great grandparents down the street, 3 sets of aunts and uncles. And so when my mother said, go out and play, I was amongst family. We can actually do that now in this climate. And, in the metropolis of Little Rock, it's not like the metropolis of Stamps, Arkansas back in the day. Population 3,000. And I think I'm giving us 500. I think it's more like population 2,500 or so,
Right. No, you're absolutely right. And, and part of and just for people to know, there's a phenomenon with 24/7 news cycle and having access to information. We tend to localize all of the stuff that's happening around the world. And so there might be areas of the country or places where more is happening. But typically the statistics regarding our safety have not significantly gone up. We just see more of the bad stuff that's happening. So we think it's gone up, and that creates a unique phenomenon that's kind of added to the political climate, because when we see that story or those stories, we tend to magnify it in our brain. Oh, it's happening in my neighborhood. It's happening in my community. If your community is 95% one particular ethnic group, the likelihood of the stuff that they're saying on the news is not happening in your area, but you think it is just because you've seen it happening in Arizona, California, Texas, whatever. So we got to be careful about that. So that's you're giving some great advice. That's why I got you. So
that's why you invited me.
If you're just joining us, you're watching House Call with Dr. Gigi. Of course, Dr. Gigi is on vacation, but I am filling in. Of course, I'm LC, and we brought on one of our favorite ex-hosts here on BDO, and that is Dr. Rhonda Mattox. You may have remembered her from, we did a number of shows called I'm Not Crazy, and so they're still on the BDO YouTube channel. I would suggest you go back. We had some fun shows on I'm Not Crazy, but so I would go check those out. You have the opportunity, and there's a variety of topics relating to mental health on BDO YouTube channel. Okay, so now they're here to see you. They regressed to the point where they can't cope on their own anymore. Friends, family, coworkers have noticed that there are some changes in their behavior. They are now still willing to go see a professional. They come to you. What is that determining factor that says this person needs medication and this person doesn't?
I start with how they're functioning. And for me, one of the telltale signs of how they're functioning is how they're sleeping. Okay. So for people who are having a lot of struggles getting to sleep for a prolonged period of time, I know their concentration is going to be off. I know their accuracy at work is going to be off. I know that they are going to be irritable and cranky, and they're just going to be a grumpy Smurf. Okay. Mm-hmm. So if I start with mood or what have you, many times people get defensive and they have to protect the illusion that they're okay. But when you start with sleep, they want sleep. They need sleep. They crave sleep. So right. So I start with sleep because that's a kind of a stigma-free zone. How are you sleeping? And sometimes people think not sleeping is a sign of strength. And so they're like, I plow through. I'm a workaholic. So they will tell you more accurately, and that will help me out. The other thing is I'll dive into other types of physical issues. Are you having headaches? Are you having stomach aches? Getting into other physical complaints that they have that may be impacting. I talk about relationships. So what I tend to do when I first get started is identify what they consider the issue, what they consider the problem is, or what those who are around them consider the problem. But sleep is really a safe place for me to start. Energy is a safe place for me to start. Are you tired? Do you enjoy the same types of activities, or are you isolating? Are you staying in rather than getting out? And I'm looking for a change in patterns. So if you're always kind of a homebody and you're staying at home, that's not a big deal. But if you were like one of us we're extra, we're out there, and now we're staying home, I'm paying attention to that. So really a deviation from patterns. I'm interested in your substance use, your recreational substance use. Are you a smoker? Are you a drinker? Are you using marijuana or different types of drugs? And for that, and specifically with alcohol, has your alcohol use changed? Has it increased? Because many times when people are feeling really anxious, they use alcohol or marijuana to calm themselves down. So as I'm diving into their recreational drug use, one of the things that I will say is, what does that do for you? And sometimes people tell me it calms me down. So I know I may need to dig into how anxious you are, or it relaxes me, or it helps me numb, or helps me not think about. And what they're telling you is this is what it helps with is what they need help with. And,
Gotcha.
you know, those types of.
So you backdoor the answer, right? And that's a good
right.
point. Yeah.
That's right.
That's a great point, because you're like, I'm good. I just need a drink or two or 4 or 5 to get my night, to relax or to let go of the stress. And like, okay, well, you need more and more substances to de-stress. That's a really great point. So those are some, I try to get as many of those. So sleep disturbances, we talked about some physical complaints, somatic concerns, or that's, if you want to use a more technical term, energy levels, being either manic, but typically we tend to withdraw. We tend to get more tired, less interest in activities that we would normally do. Change in patterns, right? That's a big thing. Some people change patterns to get themselves an energy boost. People who have been known to do that, to move, change cities, things of that nature, because you always get that surge. When you go on vacation, there's a surge of energy that happens. When you go back, you kind of regress back to the mean. So change in patterns, and then that recreational substance use, how much of that happens. So those are fantastic kind of tips for people to really see and to identify, whether it's in yourself or in a loved one, a friend, a partner, whatever, coworker. You notice that coworker is going to the bar every day after work. That might be a problem. And inviting you, and then they stop inviting you, but they're still going.
Yeah.
That's always a big thing for me. It's like when somebody is okay, particularly in substance use, doing it by themselves.
Yeah. Before we dive into that, I want to pivot back just a little bit to the somatic complaints, the physical complaints, if you will.
Right.
One of the things that particularly we do in the Black community is we are not necessarily comfortable saying I'm down or I'm sad, but we will kind of somaticize our complaints. We may have more headaches. We may have more chest pain. We may have more indigestion. And that is sometimes how our depression, our anxiety shows up. And so when I have someone who's having headaches, there are a number of instances when I'm working with people who, when their thoughts are going really fast, they have headaches. Or when they can't sleep, they have headaches. Or when they're not eating, they have headaches. And when they talk to me about stomach issues, if you ever had a child, that when a child gets nervous or what have you, they'll stomach ache. We aren't too far from children. When we are really anxious, our stomach hurts. And so if I hear about those types of physical complaints, I also know I need to dig more into anxiety.
Frequent headaches, that kind of mysterious, that chest pain, that you got to pat yourself. The big mama used to do, she sit down, pat that chest, get the ginger ale and the BC powder, and they try to figure it out. But yes, so chest pains, particularly in children, if we're noticing some change in patterns in our children's behavior, and that could be tied to bullying. This is not what we're talking about, but that could be tied to some bullying behaviors, some other kind of academic issues where they don't want to go to schools, and every morning when they're going to school, their stomach hurt all of a sudden. That could be something going on, whether it's social or a learning disability or something. So those are some signs that we can see there's a change in the behaviors of what what's going on. So I like the fact that you went and clarified and gave people some examples. The headaches is a big thing, and the sleep disturbance. Those are two big ones, because as you know, as adults, we probably need about 6 to 8 hours of uninterrupted sleep. And I have to say that because people say, I sleep for 6 to 8 hours. No, you sleep 2 hours and then 3 hours and you wake up and you go back to sleep. 6 to 8 hours of uninterrupted sleep as an adult, because that puts your body through 2 REM cycles, which is rapid eye movement.
Yeah.
And it's really how we clear our brain. You know this better than I do. I learned this from people like you.
Well, and listen, and the thing about it is, I'll ask, how are you sleeping? And they will tell me, well, and I don't stop there. I say, well, how long does it take you to get to sleep? And you would be amazed at how many people who just told me they were sleeping well will go on to tell me it takes them 3-4 hours to get to sleep. Or they'll tell me they get to sleep just fine. I say, well, do you stay asleep all night? Is it restful? Or do you wake up frequently? Oh, I wake up 5 or 6 times a night. Well, then how long does it take you to get back to sleep? 30 minutes, an hour. So why did you just say you were sleeping well? Because people have been conditioned. How are you doing? Fine. How are you sleeping? Well, they've been conditioned to just say well when they're not doing it. And so I dig in and ask those next layer questions, because I have learned that people will tell me they're doing fine and that they're sleeping well. And then afterwards, I'm just like, wait a minute, you just told me you were doing fine. Your mama died, your grandmama died. What do you mean you're doing fine? You're not doing fine.
Right. If you're doing fine, help me out. Help me.
Right.
I call it, and I don't know if this is an industry term, but I would always call it response muscle memory. Right. So people ask you a question, it's like.
That's a great way to look at that. A response. What did you call it? Response muscle memory?
Yes.
All right. I'm going to borrow that. You heard it here first with Ellis Dean.
Because that's what we always say. You're right. You may not be fine. You may not be doing well. You know, they may in their mind, particularly when we go see a doctor, right? And we've talked about this on other shows about how you try to beat the doctor, beat the test. You know, you want to eat salad for a week prior to getting blood work done.
Wait a minute. Mine is I floss right before I floss like the month before it's time. I get to flossing more regularly right before.
And you're still using that tester floss that they give you at the end of your dental appointment.
I don't want my gums to bleed before, so I floss it because
we do all of these things to avoid, because we know, hey, sometimes we feel like if we tell the doctor the truth, we're going to be seeing this doctor more often. And this avoidance is how we end up getting more and more sick, right? And so we have to be able to be a little bit more vulnerable, be honest and transparent, especially when we're talking to our physicians, because we know, hey, they are bound by law. They can't share any information. So if the one place you're going to be honest is with Dr. Mattox, right? If you go with what's going on.
This is the thing, though. And if there is a reason that you're not being honest, like look at that, because there's some of us who may have doctors who we feel that they are judging us. We feel like they're judging our weight, they're judging our alcohol choices, they're judging. And if you feel unfairly judged by your physician or therapist or what have you, then don't ignore that, because that means you're not going to come, and that's not your safe place. Right. So you're not sharing, and you're not, and we can't heal your lie. We can't treat your lie. So if you come in and you're lying to us,
that's a word right there. That's a whole sermon. We can't give you a lie.
Right. So make sure that you are with a provider that you feel safe enough to be honest with. And if you're not, have a conversation. I feel like you are judging me. I remember a lady, when I was ill, I did some stupid stuff in my youth. Okay. And so I was first year out, early career professional, had laryngitis, went to work as a psychiatrist with laryngitis, and I was writing my questions down. So I'm sick, bad move. Patient telling me about something, She's completely in herself. She tells me about someone that she's dating. I'm just trying to write the script. And then she comes back and she says to me, you don't think that I'm good enough for this type of man. And I was just like, what? And she said, I told you about this and you didn't acknowledge it. And I said, did you realize I couldn't speak? I was just there to write a script for you. So
Right.
sometimes people will take what you said and they'll go in a different way. But I'm so glad that she felt comfortable enough to
Yeah.
say something to me about that, because she could have just left saying, Dr. Mattox doesn't think that I'm good enough for a white guy, when I didn't even know she was dating a white guy, nor did I care, you know.
Right.
But that was really important to her. So even if you don't feel comfortable, sometimes just having a conversation with the provider, because you may have interpreted their judgment and they're constipated. They're not thinking about you.
And then the waterfall effect that could happen. So that person could have walked out from that office and said, oh, Dr. Mattox doesn't care. Extrapolate that to therapy doesn't work. I'm not going in, and have a whole nother cascading events, but she's unwilling to go in because she misinterpreted your response. And so we have to be very, very cognizant of that, because people fill empty space, silence, with their own interpretation.
Mm-hmm.
You have to be okay with that.
And listen, I'll give you plenty of reasons not to like me, but let me give you my own reasons. Don't just run
That's true. That's true.
Wait a minute. Wait, I do not like that you're agreeing with me.
I'm agreeing with the premise, not that.
Yes.
With the premise of it. Okay, so we're here on blackdoctor.org, and so I'm going to ask this question is more specific to our audience base. Do people of color, particularly Black Americans, do we experience stress and anxiety differently than other ethnic groups?
That's tough for me, because in my heart of hearts, what I try to think about is that we have more in common than we don't. And so I will say, I want to be an expert in this area, but I don't know that we do. I think when people feel stressed, they may catastrophize some things and make it bigger. Meaning they'll make a mountain out of a molehill. Some people will isolate and reflect and overthink about it. Some people, and so I just think, I struggle to say that we experience it differently. We may express it differently. I don't know if the experience is differently. Like, we may feel more comfortable expressing anger than sadness sometimes. We may feel more comfortable expressing frustration, because those feel like strong emotions. And we're maybe less comfortable with vulnerability, with talking about sadness or worry. We may be okay with saying I'm concerned, but we're not okay with saying I'm worried. So the language that we use may differ, but I'm not sure if the experience differs. And I don't know.
That's a good point. So instead of saying, do we experience it differently, maybe we express it differently.
Yeah.
How we're experiencing. So the experience of stress is happening, but the expression, because of certain factors, including ethnicity, what we feel comfortable, because we may not feel comfortable going, we might not feel comfortable going to, I got a friend for 30 years. I have many friends that I've had for over 30 years, and we haven't had a vulnerable conversation. It's been very, very surfacey. The muscle memory kicks in every time you see them. Hey, how's it going? Life is good. I've got my canned response. I'll be honest, and someone probably watching this program. I got my canned responses. Hey, I could complain, but
right.
I couldn't remember why.
And I'll say, like, a number of the people that I know do not drink in work settings. And I remember being in a work setting, and really being ostracized because there is no way on the planet I'm going to drink with coworkers.
Okay.
And the truth be told, I'm probably going, if I'm going to drink, it would be like on New Year's Eve or something like that. I mean, so if I'm going to drink it, maybe like once a year or once every 4 or 5 years or something, because I'm not a drinker. It just doesn't taste good to me.
Right.
I wish I could say it was for religious reasons, but it's not good to me. Okay. If it tasted like Kool-Aid, I might be more inclined.
You don't want to drink those. Those are the bad drinks.
I've not had Kool-Aid in years, but the red kind, not cherry, not strawberry, red.
Red. That's a whole flavor.
Right. Flavor. But and people of color who can recall seeing others let their guard down and then be lynched or what have you, may not be as inclined to drink in settings or to let their guard down because they realize that they may be being evaluated differently at work than their counterparts, or at least whether that's the case or not, that's the perception, right? And so
no, that's the case. I recently shared with my daughter, who's in grad school, to be a counselor, as a matter of fact, and so. I shared with her, they did a study with some teachers, and they had children sitting around the table of different ethnicities. One was a black boy, black girl, white girl, Asian. And they asked the teachers to, watch the kids doing the activity. They told the teachers one thing, but they were really watching, they told them to watch the child that they felt like was doing the activity wrong, incorrectly. And what they saw was the teachers focused their attention on the black male child, way more than the other students. So it was almost like they were waiting for him to do something wrong, incorrect, versus kind of generally assessing all the other students. I think there is a component of our existence in this country that when we walk into mixed settings, there is, so your wall of, hey, I'm not drinking with coworkers. I'm not doing it. So because my wife, same way, she had 2 glasses of wine and then she's deucing them out because she knows as the night goes on, they start getting more and more inebriated. And I'm not, one, I don't want to be exposed to that, and 2, I don't want to have my name in if something goes awry. I'm not gonna have my name in it. So it's definitely a protective kind of space for us because we understand that we're always being evaluated, even in a quote unquote social setting. We're still being evaluated and our behavior is still being scrutinized in those places. I do go and I do have, drinks with coworkers. Now, the things that I don't do, I don't take pictures with a drink in my hand. I don't do that. I don't do that with my friends. I just, it was a personal thing. I never even did that in college when it was like you really didn't care. Everyone was taking pictures. And they was like, hey, take a picture. And I'm like, oh wait. And I'd put my drink down or I'd put it behind my back. And I'd take the picture because pictures live in perpetuity. And I never wanted to have that image of me because it could be misinterpreted. Y'all were getting it in. Y'all, what was he drinking? Like, that should not be the focus. The focus is the fellowship. The focus is the people that are there enjoying each other's company. The focus should not be whatever I have in my hand. And so I always put it out, even if it was just a soda or something. But if it was one of those red cups, the red cup?
Yes.
Red cup is a universal. Alcohol has co-opted the red cup, so you can't.
Well, I have to tell you, I didn't realize that. So thank you for sharing it with me. Wait a minute now. I'm feeling a certain kind of way because I have red. I mean, this is what we drink out of in my house. I didn't know that the red cup was associated with alcohol.
Oh,
Is that
yeah.
right?
Yeah, look, I'm trying to tell you.
Listen, I'm not gonna drink out the red cup at home no more when I'm on Zoom. Then you just
The ridges on the red cup are measurements. So like the bottom, that from the bottom to that first ridge is 1 ounce. Is 1 ounce from this. Oh yes, that red cup is designed for alcohol consumption. So
if
just
you're
FYI,
just tuning in, this is not a talk about alcohol. This is a talk about what are we talking about?
we're talking about coping in these turbulent times, and we are talking
Well,
about
and
what
alcohol is can be a coping mechanism, but
it
that's not
can
what
be.
this talk is about.
But yes, so and we really got derailed a little bit. So if you're joining us, and we got just a little bit, a little tangential.
Not derailed. It's relevant. It's
It
definitely
is relevant.
relevant. It's relevant.
It is relevant because we're talking about how we experience stressors, right? Whether they're mild stressors or whether they're extreme. And one of those, and some of those things that are artificial stressors on people of color are living in a majority culture and that constant evaluation, that whether it is actual or perceived, there is a stressor that comes with I'm walking into a place where I'm a minority and all eyes are going to be on me, whether I feel like it is, whether it's a mild paranoia or it's a reality in it. And we've seen enough videos on social media to know that there's a reality that comes with being a person of color in spaces where you're a minority, that there are all eyes on you, and the interpretation of your behavior could be very, very miscued and is built upon, you know, bias and all of these other things that have been built into the country. And so that is a stressful place. When we walk out of the house, we're stressful. We're stressed.
And I'll add that we talk a lot about authenticity, about bringing your whole self. And when you realize that if you are passionate, that particularly as a woman, you can be labeled the angry Black woman.
Right.
And we saw during the elections, the laughter, the joyful. It was the anger at being a joyful woman.
Right.
Okay. We've seen, with Shadur Sanders, the confidence interpreted as cockiness, the having a solid foundation. And so there's this balance of, oh, how do I present? Don't sound too happy, don't seem too, and so trying to be stoic so that you don't offend the coworkers. And that is a burden. Some people have called it a black tax that carries a weight that other people may not have to think about, but that folks feel that it is something that they have to give credence to pay attention to in order to navigate and to be perceived as safe. And so I've had, one of our friends of the show, of our show back in the day, Louisiana, Dr. Griggs. Dr. Griggs talked about having his white coat in the car, or perhaps having glasses on so he could seem like a safe Black man. And so these are our conversations that people are having behind closed doors that really do carry weight. And I can recall a psychiatrist asking me about sexism and my experience with sexism. And sexism had never, ever once crossed my mind, and when she started to talk about ageism, that had absolutely never crossed my mind, like never. And I never saw anything through a lens of sexism or ageism. It just never crossed my mind. And it didn't occur to me that I was walking in these intersections and my multi-hyphenate person was being judged for anything other than merit or being Black.
Right.
I didn't even think about sexism or any of that stuff. And so sometimes, you may have blinders on and you don't even see things.
Well, we all have a lens and a perspective that colors how we see things. no pun intended. I think one of the things that the challenges that we have, and I would say any, and I'm using this term loosely, subgroup in this country, um, has to devote mental energy to how they are perceived by majority culture. And women have to put mental energy into safety that men don't have to think about, right? And so my wife always talks about, she took a course in personal public safety in college. I was like, there was a course for that? And she was like, yes. And so she behaves, when she travels for work, she behaves very, very differently. As a woman in a hotel, there's certain rooms she won't take on certain floors. She likes to be closer to the elevator, never at the end of the hallway. Will not stay in a motel where the doors are facing to the outside. There's a lot of different things. If she's eating at the hotel restaurant, she sits at the bar, maybe has some conversation with the bartender, get the know. So there's always somebody that knows. No more than, especially by yourself, no more than one drink. Any other thing, if she takes another glass of wine, she's taking it back to the room. She always puts that latch on there. Like, that latch got to go. The latch has got to go on. So there are things that, and then when you're talking about trying to date, so that's a married woman. Then when you're talking about dating, going out with somebody that's unfamiliar, you don't know, are they driving? Do you drive? Do you drive separately? There's all these little things that are going through that men don't even have to experience. And when you're giving up that much mental energy, thinking about something, thinking about how you perceive, that can be stressful. And how is that impacting your ability to be your authentic self, as you mentioned? How is that impacting your ability to be authentically you when you know that being authentically you could be detrimental, even though it's not? Being gregarious, being fun, being passionate, all of those things in and of itself aren't considered bad traits, but wrapped in the wrong package could be a detriment to your success.
Yeah. Hey, Vicki Walker, we're glad you're here.
She gave you a shout out. She was like, hey, the safe spaces are great. And as we're getting closer to the end of the program, I want a couple of things,
already.
Yes, we need to our way to the. Okay, so we talked about medication. All right, so quickly for medication, if they lean in, can somebody get off of medications?
Oh yeah, absolutely. My goal for you is not for you to be on 4 or 5 different medicines. I want you on the least amount of medicines. I want you on the smallest dose that does the trick. Okay. So traditionally, when I'm starting a medicine, I don't start at the recommended dose, and certainly not in my Latino population, my Asian population, my Black population, because I realized that we probably were not involved in the studies that identified the dosing. So I like to start at a low dose because I know that you're less likely to have side effects when I start a low dose. And understanding that you all don't want to be on medicine, I really might have just one shot. If I give you something that makes you feel sick, you're going to throw the medicine away. You're going to throw me away as well. So I start at a low dose. I perhaps over-explain potential things so that you know what to expect and you don't get scared. And when I'm taking you off the medicine, listen, I repeat, do not abruptly stop some medicine.
Right.
I want to wean you off of it most of the time. And depending on now, if you've just been on it 3 days, I don't have to wean you off of it. But if you've been on it a year, you don't just want to just cold turkey stop a medicine, particularly if it's like Effexor or Paxil or some of those medicines, because you're going to have some withdrawal. So right. Let me slowly wean you off of it, depending on the dose that you're on. And then also tell you what to expect as you're coming off of this, so that I can say, if you are on Lamictal 200 and you say, I want to be off this medicine. And I have kids who tell me, I want to be off this medicine because I want to go to the military. So I will go from 200 to 100, and I'll stay there for a month or so and see, are you okay? Or do you have an uptick in symptoms? If you have an uptick in symptoms, then I'll bump you back up to 150 or so. But I'd rather know that you're having an uptick in symptoms with just 100 milligrams than for me to just go from 200 to 0, and then you're suicidal.
Gotcha. Exactly.
So yeah, so you can come down, and I'll start to space your appointments out. So maybe in the beginning we're meeting every month, and then we go to every 3 months, and we space it out as well. The goal is for you not to need me. I don't want people to need me. I don't want to be a crutch or any such thing. I want you walking in your authority, in your independence. And I want to just be somebody that you wave to. Hey, Dr. Mattox, girl, I'm good. That's right. I'm so proud of you. All right.
Absolutely. And that requires to get off of medication. That does require some work.
And here's the thing. And sometimes you may not.
Right.
You may not get off the medicines.
Right.
And my patients who have bipolar disorder, I do not recommend that they get off medicines cold turkey, particularly if they've had suicidal ideations, they've had recent suicide attempts, if they are substance users when they are not. I don't want, so because if I bring you off of it and you have a history of substance use and I bring you off of it cold turkey and I do it rapidly, then it is possible you will ditch an FDA approved medicine and then you will pick up June bugs, street pharmaceuticals. No offense to June bugs out there. I love you, June bugs. Okay.
Right. That was a random. That was a grab bag of nicknames. She could have said man. She could have said whatever nickname.
And I don't mean to offend you, because the next time it will be Pookie or Pee Wee.
So we're gonna let you go with this question. And how important is boundary setting during stressful times?
It may be number one, because boundary setting, if you don't have it, it leads to overwhelm because you keep saying yes to stuff you should be saying no to. It leads to resentment of people who you feel like are using you because you always say yes, and they just see you as a team player. They see you as, we can always count on her. And those people who folks tell me they can always count on, that's a team player that never says no, I have concerns, because I think this is somebody that's going to snap one day, and it's not going to be pretty. And I am the person, well, no, people don't say they can always count on me. And when I see people say, you can call me anytime online, I'm thinking, you can't call me anytime. You can call anytime, but I'm not going to answer anytime. You better call Tyrone.
That's right. Tell him come on. I feel you on that one. Yeah. So, and I thought this was important, and I'm glad you phrased it in the way which I knew you would give people, because it's important to recognize that taking on more when we're already stressed is the wrong thing to do. We do have to learn how to properly and effectively set boundaries, right? And we're still learning, and we always are learning. Some people are really, really good at it. Typically, people that are very successful are really, really good at it. But the rest of us had to learn how to do it as we worked our way into a space where we have more control over our time. And, especially when friends, family, church members, whatever, ask you to do something, there's an implied yes that comes with those questions sometimes. When your boss asks you something, there's an implied yes. Even a coworker, a peer, asks you to do something for them, there's an implied yes. And really, sometimes boundary setting could be, yes, but here's what I need from you in order for me to do this effectively. and not just them doing it. And I've been learning that in my role at work is like, okay, I'm a one-man team. So when you just say, I need this, no, okay, I can do that. Well, here's what I need from you in order for that to be the maximum thing that you really want. And because sometimes what they're asking for is, I need your creativity. I need you to do it, just figure it out from start to finish. That is very time consuming, draining and stressful. So give them that boundary and say, hey.
Yeah. And I just want to add, and sometimes people don't ask you, they just present the need. And then the superhero in us leaps to the rescue. I can do that. Stop it, stop it, stop. Stop volunteering for stuff that you can do and you can do it well. But it's going to take away from your Saturday mornings with your kids. It's going to take away from your relaxation time. It's going to take away from your me time. It's going to take away from your ability to sit still and hear from your creator. And so stop volunteering, even if you can do it. Please stop it. And when you think about it tomorrow, see me saying, stop it. Stop. Go get some rest. Rest is a revolutionary act. It is an act of faith. You have to. Rest was so important that in 3 different biblical traditions, it was punished by death if you did it on the Sabbath. You need your rest. Your body needs to recuperate, and you need to sit down somewhere, or your grandmama would say, you need to sit down somewhere and be still. Go sit down and be still.
Absolutely. I want to put this, because you just said a word right there.
That was for both of us.
Love. Because absolutely understanding all of the positive implications that come from having sufficient rest, particularly for your brain, for your body, and that just kind of flushing out of our system. But also it does help you recharge, and then if you put the right fuel in, so all of these things are connected. We talked about that on the first show, but I love it. Rest is a revolutionary act. Please get your rest, set your boundaries. And also, and one little piece I would talk about on the people asking you to do things, give them real time that's going to take you, and give yourself some more time, right? So don't say, well, I'll get this to you tomorrow. Even if you could, tell them I'm going to give it to you in a week. And then if you gave it to them tomorrow, hey, then you're Superman. But if you tell them tomorrow and it takes you 3 days, right, man, take them 3 days. But you've already said yes to, but they don't know how many people you've said yes to. They know about their thing that they've asked you for. So when we start saying yes, we've got to get out of that space of this becomes the most important thing I got to do. No, okay, well, I've got a few other projects I'm working on. That's the boundary. And then say, I can get to it. It's probably going to take me about a week or so.
Now, I'm going to give you some homework today.
Okay.
So when, and this is for anybody who listens to this show, your homework is to start saying no at least 3 times a day. And when I do this with my coaching clients, their eyes get big, and I'll say, practice on your dog, practice on your child, practice on the lady at the counter. Don't start with your boss, because one of my clients started with her boss. I was like, wait, hold on. I wouldn't tell you to go tell your boss no now. Wait now, because I don't have any money to help you when you get fired for telling your boss no. So, but practice your no's. And the goal for that is for you to see that you won't combust and blow up, and you will survive, and that people will be able to accept your no. And so we will start to write out scripts for how you're going to say no, right? And because it's going to, and if you said yes, but you should have said no, the next time how you say no, you have to start practicing your no so that you can say yes to you.
Oh, I love it. We're going to end on that note. Thank you, Dr. Rhonda. Thank you, Dr. Gigi. We'll be back in a couple of weeks after she comes back from her trip. We'd love to have you back. You're always welcome. You have a standing invitation. I'm saying that as a producer of the show. You have a standing invitation. So if you say, hey, what are y'all talking about this week? We got it. This show is every other week. So we'll be here you're more than welcome to come back. And then we've got some other projects that we're going to be working on as well. So thank you all for joining us. Thank you, Vicki, for that wonderful comment. Remember what we've learned today. Number one, identify a safe space. 2, take a staycation. Those are some things that you can do. Here's some things. How do you determine if you need some medication? Is there a sleep disturbance? Are you having some physical complaints, chest pain, random physical complaints, headaches, things of that nature? Is there a change in your energy levels? Change in the patterns of things that you're doing? Are there some significant changes? And if there's some changes in the substance use abuse, those are some real kind of signs that you might need to talk to somebody and see if there is a potential for you getting on some medication. So, and also your homework.
Say no.
Practice saying no. No is a complete sentence. So if there's a pause and there's silence, you don't have to fill that silence with why you're saying no. Yes. It's a full, complete sentence. No, I'm not going to do that. Well, thanks again. Thank you all for joining us. And we'll see y'all in 2 weeks.
Thank you.